Hello and welcome to our final project. Our final project is on the Fragile X syndrome. So what is the Fragile X syndrome? According to the National Fragile X Foundation, Fragile X syndrome is a genetic condition that causes mental disability, behavior and learning challenges, and various other physical characteristics. It results from a repetition of the trinucleotide CGG in the FMR1 gene on the X chromosome. Normally, the repeat sequence of the CGG ranges from 5 to 44, but in this condition, they could repeat many more times, and the more they repeat, the more severe the case of Fragile X syndrome is. Fragile X syndrome is the most common cause of intellectual disability that has a genetic link. We see it more in males than females and is most of the time less severe in females. We might not recognize it in infants right away, but symptoms may show up as developmental delays towards puberty. Physical characteristics become more pronounced around this time. As Fragile X syndrome is passed on from generation to generation, the condition gets worse. Some of its physical characteristics are long and narrow faces, large ears and prominent jaw, macrocephaly, flat feet, joint hypermobility, macroorganism. Some of the psychological developmental characteristics of Fragile X syndrome are ADHD, anxiety, autism, intellectual disabilities, language problems, cross eyes, recurrent ear infection, GI complaints, obesity, and seizures. This might be an easier way for someone to understand what Fragile X syndrome is. Fragile X syndrome is a genetic disorder. One of our genes in our body, we call it the FMR1 gene, it makes a protein. We call that protein the FMRP protein. And this protein is needed for normal brain development as we are formed. If someone has Fragile X syndrome, they do not make enough of the protein FMRP, causing abnormal brain development.
So now that we have talked about what Fragile X syndrome is, I will talk about the possible questions that would be elicited from family members to determine any possible chance of the family having this genetic mutation. First off, let's discuss how we as healthcare providers would gain knowledge from the family in question. It would be best to gain knowledge in the form of an interview with questionnaire-like format elicited by the healthcare provider. A collection of information would include current family health status, psychosocial disorders, psychomotor ailments, physical impairments, mental disorders, and defining physical characteristics. Questions should also be open-ended to allow the patient to elaborate and allow the interview to ask more questions to gain more in-depth detail. Questions should also span at least 3 generations of the family to help determine who the carrier of the genetic mutation would be. Any family illnesses or disorders would also need to be brought up because these can actually be linked with having the genetic mutation. I have a few questions listed on the slide that may be used to gain insight into the family history and help determine any linkage with Fragile X syndrome. The questions on the slide are based off of characteristics of someone that may have the gene mutation, as stated a few slides ago in this presentation. When I was doing my research about what questions may be asked of the family to help determine if there was a link to Fragile X syndrome, I found that the CDC explained that the majority of people diagnosed with this genetic mutation are diagnosed at an early age. Males can be diagnosed as early as 36 months, and females can be diagnosed as early as 42 months. I also found out that there are variations that can result in people being affected later on in their life, in their adulthood, with signs and symptoms such as tremors and reproductive issues. So in the questions below, some are more geared towards children, while others are more geared towards adults. All of these questions do not point to a specific diagnosis of Fragile X, but can help determine if there may be a family history or linkage, although the only definitive diagnosis can come from DNA testing. As you can see, there are many questions listed on the slide, and even more would be asked of the family. Please feel free to read through them now.
Hello, my name is Suzanne Gessner. I'm a registered nurse working in general surgery. So at this point, you may be wondering how a staff nurse or how you can contribute to provisions or arrangements for genetic services for a patient with or at risk for Fragile X. The first step and most important step is making sure the patient has a documented 3-generational medical history. Do not assume that this information is updated in their record because they have an established relationship with a primary care provider. This oftentimes, in my experience, is not the case. So make sure you take any opportunity you have with a patient to do some conversations in between interventions to update this record. We're also going to talk about genetic education, and last and most importantly, facilitating genetic services. So when is a genetic referral appropriate? The Association of Clinical Medical Genetic Guidelines recommend a genetic referral for an individual or family with one or more genetic conditions. However, the National Foundation for Fragile X guidelines recommend a genetic referral for a person with a group of problems since birth, such as congenital anomalies, extreme or exceptional presentation of intellectual and or learning disabilities. Okay, it's really important to remember that nurses should not attempt to provide genetic counseling. This is beyond the scope of practice. However, a nurse can advocate for a genetic referral. Providers may not think to order a genetic referral. Share your concerns, advocate for your patient. A nurse can educate the patient of benefits to genetic counseling, such as health promotion, medications to treat symptoms, access to psychological counseling, access to Fragile X specific treatments for speech, occupational therapy, and physical therapy. And then there's family supportive services through the National Foundation for Fragile X, maybe provide. If you have a patient with a diagnosis of Fragile X or a family member, access to the website, share that information with families. They can help insurance payment through providing CPT codes necessary for insurance reimbursement. They help with transportation costs. And then there's actually Fragile X specific clinics. And then lastly, facilitate an appointment with a genetic counselor. Use your resources. Every organization has intranet. Find out who your genetic resources are at your facility and keep that somewhere close to your heart, and make those phone calls necessary to assist your patient.
Since Fragile X syndrome does not have a cure, the treatment is supportive. It requires a multidisciplinary team that includes anxiety-reducing measures, behavior modification, and medications to manage associated psychiatric disorders. Individual education plans are necessary for all school-aged children. Since the symptoms of Fragile X syndrome are different in each individual that is diagnosed, the treatment plan needs to be tailored to that individual patient. Treatments may include physical therapy, occupational therapy, speech therapy, medications, surgery, genetic counseling, and family support. According to the National Fragile X Foundation, there are many areas of treatment and intervention that can improve the lives of affected individuals and their families. Given the proper education, therapy, and support, all persons with Fragile X syndrome can make progress. Fragile X syndrome is one of 3 variations of problems resulting from reduced or absent expression of the Fragile X mental retardation 1 gene. There was a time when Fragile X syndrome was thought to be an X-linked recessive pattern. That means mothers can only transmit the disorder to their sons. We now know that females can express the disorder as well as males.